good, thank you. My name is Gabby. I'm the nurse. I'm just doing my rounds right now to check on my patients. How's Mrs. Anderson doing, Dr. Cam?
So Mrs. Anderson is currently asleep. Okay. It seems that she is experiencing delirium due to an infection caused by her hip surgery. So I have double-checked the lab results to make sure, and she does have elevated leukocytes. So with that being said, I started her on a course of amoxil to treat her for this. Is there anything else that you need?
No, that should be good.
I'll leave for now then.
Okay, thank you.
Yeah.
Delirium? She was here for hip surgery. She's been doing fine. What's going on?
Yeah.
I don't understand.
Well, your grandmother's sleeping right now, but would you like to step out in the hallway and I can explain what's going on?
Okay.
Okay,
Yeah.
follow me.
Okay. Bye, Grandma.
Bye, Grandma.
Yeah. I don't understand what's happening. I'm really worried about my grandma.
I can definitely understand why you're feeling afraid. The way delirium presents itself can be quite scary. We often see it in the hospital, especially in older adults. Do you know what delirium is?
No, I haven't known it.
Well, delirium is a temporary and sudden impairment in somebody's ability to think straight. People who experience delirium display various symptoms. Some may be low in energy and tired, and in your grandmother's case, she had hyperactive symptoms. That means that she was agitated, restless, and irritable.
Okay, so she was acting this way because of her delirium? But what causes it? Will she be okay?
Delirium can be caused by numerous different things, but it's usually from a physiological cause. This means that something in her body isn't working as it should be. Because your grandmother underwent surgery for a hip fracture, we believe that the main cause of your grandmother's condition is an infection that she acquired a couple days after the procedure.
So what does that mean for her?
Well, the good news is that because we recognize the symptoms, we were able to start treatment early. This means that your grandmother will most likely make a full recovery without complications.
Well, that's good to hear, but how do you fix it?
Delirium is resolved by treating the underlying issue, which in your grandma's case was an infection. So we're giving her fluids to keep her hydrated and giving her medication that fights the bacteria in her body. That should help her feel better. We also are keeping a close eye on her to make sure she's recovering properly.
What happens if the treatment doesn't work?
In the most extreme cases, delirium may cause serious brain damage and it can potentially be fatal. However, if the healthcare team recognizes that the treatment isn't working, we'll create a new treatment plan and continue to closely monitor your grandmother. Thankfully, she's in stable condition and there's no immediate cause for concern.
So we have nothing to worry about though? She'll be okay?
As I mentioned before, delirium may be caused by numerous things. Because we believe the infection is the main culprit, the medication we gave her should help her feel better.
Okay, so she'll be fine by tonight then?
Well, the medication she's taking needs a full week to fully get rid of the infection.
So is there anything that we can do to help her?
It's wonderful that you're here to visit your grandma. Being here for her in this difficult time is a great way to help her through the healing process.
Okay, well we'll try and continue to visit as often as we can and help out.
Okay, so here's some information for you to take home, just in case you want to go over what we discussed today.
Yeah.
Did you have any other questions for me?
No, you explained everything very well. Yeah.
Okay, great. So if you have any other concerns or questions, please don't hesitate to ask.
Okay, thanks so much.
Yeah, thank you.
Okay, how about we go check up on your grandma?
Sure.
Okay.
Okay.